Part of being a dancer is to really understand what's going on with your body. I run, I do a lot of things that are very stressful on bodies, but I take care of myself or I wouldn't be at this age still working professionally. I got up one morning and I couldn't put weight on my leg.
Arthritis involves damage to the joint, and that means that there is loss of cartilage, whereby there's bone rubbing on bone.
We went through the steroid injections and physical therapy and anti-inflammatories, and that was good. And then it didn't help anymore because there was arthritis and it was not going to be getting any better. And the idea of having major surgery is never a comfortable idea, but my feeling was it's not going to get any better. It was already compromising my professional life and my personal life. I saw no reason to wait.
Patients naturally and understandably have some trepidation as they approach a significant surgery. We try to prepare the patient for what to expect from the surgical experience. They come in for a preoperative appointment where they meet many of those individuals on the team so that when the day of surgery arrives, they're very confident and comfortable and well prepared for what to expect.
I reassure patients in that joint replacement surgery has been done since the 1940s and 50s, but since that time, the operation has evolved considerably. It has become much less invasive. In contemporary joint replacement, we no longer cut tendons and ligaments and muscles, but preserve those soft tissues. And as a result, the patient recovers very quickly.
Typically, they're up and walking around in the hallway of the hospital that same afternoon. And that's surprising to a lot of patients, but I think that first time up and walking down the hall really builds their confidence and helps them realize that, hey, this is going to be okay.
My experience was what everyone's experience should be. I lead a very physically active life. I was very optimistic. I had a wonderful surgeon and good support at the hospital.
Once the transition to home occurs, we still have members of our team who will visit the patient at their home for the first couple of weeks. And then we tend to see them back in the office sometime around 3 weeks after the operation. And oftentimes at that point, the patients are arriving with a big smile.
And once I got back to teaching dance again, it felt wonderful.